all three frameworks and the strategies that we can glean from these various countries. Although we're here to talk about international experience, but I'm also, I can't help but reminded of the lessons that we could possibly learn from the LGBT movement right here in the US. There are actually some really important parallels that those of us who work in obesity sometimes don't think about right across the fence within our own country. So the postmodern LGBT movement really, I think, started with this outcry, right, in the 80s and the 90s due to the inadequate public response to AIDS. And beginning in the mid-1990s, as the sort of AIDS crisis began to be a little bit more under control, the organizations that were spurred and created during that initial punctuated event, if you will, began to think about more holistically and systematically what the US as a country needed in order to advance LGBT rights. And so there were 5 things that happened between then and now, roughly 20 years span. The first is the coherence around 3 common causes. The first one is marriage equality. The second one is the repeal of military ban for openly gay service members. And then the third one is employment non-discrimination. And so we've achieved 2 of those for the most part, but not the third yet. But that actually was strategically a very important move on part of the LGBT organizations and the movement at large, which is to define common goals and a limited set of common goals. And I think that in the obesity world, we haven't quite figured out exactly what our common targets are. The second thing that came out of this movement was really the sort of strategic alignment and allocation of power and resources. So for example, a very strong lobbying, grassroots mobilization arm was developed. There are a very strong coalition of fundraisers that raise money not only to support programs, but to funnel money into the politics stream so that we can elect politicians that will fight for the LGBT cause at the local, state, and national levels. And then the third arm is a coalition of legal teams. So using litigation as a key strategy to not only bring issues to the courts, but bring the issues to the public. Because as these legal litigations were pursued, inevitably there was media coverage that ensued. And then the fourth thing that came out was streamlined messaging. And this also included very, very strong media advocacy. So I don't know if people know of the organization called GLAAD, which used to be called the Gay and Lesbian Alliance Against Defamation. They don't use that long name anymore, it's just GLAAD now. But GLAAD actually, over a long period of time, tracked the inclusion, the degree of inclusion and the nature of portrayal of gay and lesbian characters on TV. And it's been producing what is known as the Network Responsibility Index every year or every 2 years. And that has been hugely influential on the programming on television, which of course contributed to the changes that we've seen in terms of public opinions around LGBT rights. And during this whole process, there were also, failures and lessons that were learned from those failures. So in terms of media advocacy, one of the lessons that was learned, maybe this probably happened, I would say, 5, 6 years ago, was that the way the issues were framed was not working. The issue that gay people couldn't get married, so therefore they're losing out on all these rights, these tax benefits, so on and so forth, that wasn't working. And so a group in Australia came out with this really emotionally appealing ad that was circulated on YouTube that actually stepped away from that frame and began to show people that gay couples are just loving people, ordinary folks, raising families, paying taxes. And that emotional appeal turned out to be actually much more effective than the frame around rights. And so that really changed, I think, the nature of media advocacy in the movement. So anyway, I think there's so much we can learn from non-health related movements, both in the US and outside, that could really inform what do we do next in terms of obesity. So anyway, just very quickly, I want to say that focusing on the demand and focusing on what political science can offer through these various issues that I talked about really fit in nicely with this concept of systems interventions. So much of our work is on the elements, and to some extent with policy prescriptions, trying to focus on the structure. But focusing on this sort of supply and demand issue begin to get us at looking at the feedbacks. And then of course, thinking beyond the nutritional domain helps redefine the goals. And this culture of health notion really brings about new goals. And hopefully it begins to move us from a more problem-oriented paradigm to a solution-oriented paradigm. Okay, I know I'm running out of time, so just to say that we know that we have all these insights from system science. This is not new. We've known this for many, many years from other fields. So I think we have some guiding principles for how we can rethink the questions that we should ask beyond the ones that we already have.